So I'll start looking at your eyes. If we just wanted to look here at my forehead, I'll start with your left eye first.
Sounds good.
So you've got what's called a true blue coloured eye, which is actually a lymphatic constitution. It means that you are more susceptible to upper respiratory problems, and you may have had like liver ear infections as a child. Your resilience is quite good, so which means that you are less susceptible to getting sick, and if you do get unwell, you generally heal quite quickly and well. You have got a very small ANW, which is your autonomic nervous brief, which indicates that you may have a slightly compromised nervous system. It's also quite grey, indicative of digestive complaints, which you obviously mentioned yourself. You've got some what's called solar radiosolaris, which is heading up towards your head region. Do you have any problems with anxiety or any other sort of, not so much mental, but problems where you might get a little bit of depression or get a little bit anxious in situations?
Maybe anxiety.
A little bit of anxiety?
Yeah.
There's also a little bit of yellowing towards that area, so it may correlate to your gut-brain axis, which is quite common in people that suffer with anxiety. A lot of gut issues can cause you to have like depressed or anxious kind of states. So it may be something you could work on with your digestive system. Let's have another look. We've also got some pigment in the arm area, which, have you ever broken your arm or had any problems with your left arm?
Broke it twice.
I've broken your arm twice.
Yes.
So that's a spot over here. I'll just have a look now using the pen light, so I'll turn that front on off, just let me know if this gets a bit much. So this torch is actually looking at the depth of any of the shading and looking there which might be present in your eye. Your eyes are actually really good. There's only a couple of little spots down the bottom, and I'll show you where they relate to on the iris chart. We've got quite a prominent scurf ring around the outside of this eye as well. Do you have any skin complaints? No problem with the skin?
No, skin's really good.
Okay,
It's
so
been dry in summer.
dry in summer. Okay. So your pupils are also quite small, which is also a nervous system sort of indication that there might be some issues with your nervous system. But other than that, your eyes are that eye's actually quite good. I'll have a look at your right eye now. Just look with me. Okay, same in this eye. Your ANW is quite erratic as well. A fair bit more yellowing in this eye up towards the head area. But your resilience, like I said before, is really good. There's no major landmarks or anything. There might be a little bit of language shading on the bottom part there, which I'll show you on the picture here. So just in this region, in here, so it's in the kidney sort of region of that eye. Have you had any kidney troubles, or have you had any like multiple urinary tract or bladder infections or anything like that? Not that you can remember, not as a child? No. No. I'll just use the other torch as well for this one. fairly clear. Like I said, there's the same as in the other eye, the radius low heading up towards the head region. Quite often that presents as leaky gut. Considering you've got quite a bit of greyness in there, I would say that you probably have got a little bit of leaky gut, or definitely some digestive issues that are going on. There is a stirring in this eye as well. Like I said before, that you're a little bit dry skin, so it might be indicative of that. So is there anything else that you can note with your any of the other systems of your body? You don't have any other problems with your kidneys or your heart or anything like that? No?
All pretty good.
So it's just your digestive.
Yep.
So if you have a look on these two maps here, you'll see this whole top section here where you get a fair bit of the radius solaris that I was talking about, are lines that are heading up towards your eye, from your pupil towards the outer part of your iris. All of those are different areas of the head zone. So you've got anxieties there, and you've got vitality and senses and perfectionism. They're all areas that are influenced and obviously present in the head zone. So you've got quite a bit of clouding here. You mentioned that you get a little bit of anxiety, so that's indicated with your irises. So it might be something that you want to consider. Balance, it's about just balance within your body. And it's the same thing as in both eyes, that head zone there. You can see the other areas where I pointed out before that there was in your right eye there was a spot on your kidney zone, but you mentioned there was nothing really that you knew of in your past history or currently that you have with your kidneys. So that can be from a hereditary point of view. Do you know if any of your family members have had any problems with their kidneys? No one's passed away from cancer, kidneys, or anything like that? Any kidney issues?
I'm not sure.
I'm not sure. Okay, might be just something to...
A few are cancer, but don't know if it's kidneys.
Might be something just to maybe consider, not so much as a preventative for yourself, but just to take into consideration in time to come to maybe, really think about the food and drinking choices that you make, so that you've got, you keep up that good integrity within your kidneys. Other than that, your digestive system obviously is your biggest concern. That's what you've come here today for, and it is definitely seen in both of your irises. With your general presentation of both irises is that it's a little bit of stick because there's a little bit of white clouding amongst the eyes. So to kind of combat that, we would recommend that you try maybe eat a more alkaline style diet. Have you ever heard of an alkaline style diet? So lots of foods that are acidic are things like meats, some nuts, your not so good oils. They all contribute to raising the acidity in your body. So it might be beneficial for you to help with your digestive issues, to maybe lay off these stick kinds of food, or your processed food, your processed sugars. Maybe go down to more of a whole foods diet and incorporate lots more fruits and vegetables into your diet to help produce a little bit more of an alkaline state within your body. That will also help with any of your nutritional imbalances that you may have, but more so the digestive issues that you're having. And other than that, with your skin, quite often when you can have a stirring, it's because other systems in your body, your skin is overcompensating for other systems in your body that are under stress. I would say that those systems would be your digestive system, obviously, because it's the one that's showing the most complaint. So I would probably address the digestive system, and you'll find that your skin might actually improve as well. And other than that, do you have any other questions that you think you would like to answer?
No, all good.
Okay. No worries. Well, I think if you address your digestive concerns, that you will see, certainly you will lessen your IBS symptoms that you feel like you're having. But I would recommend though that you do go and see your general practitioner if you've got a local family doctor. they might be able to run some tests and see if it can be diagnosed with irritable bowel. After that, then maybe you'll be able to go on that particular type of diet and maybe eliminate foods that you know are going to be your main triggers. So if you've got a GP that you can see for that.
Yeah.
So I recommend that you probably go and see your GP, and once if you get a diagnosis, obviously come back if you like for some help with dietary recommendations, and we'll try and get your gut health back to normal.
Yeah. Sounds good.